So many people ask, what are the newest mainstream and not as mainstream treatments for erectile dysfunction and in men's health? So we're going to go through them one by one. Part of that is, of course, going to be dealing with testosterone, which I am going to do in a separate video, and I've done several videos on this channel before, so you can definitely check them out. But we're going to deal with two specific things regarding lab work first, and then we're going to go into more of the newer things, some injections, and so on. For men that are having some issue with erection, the first thing you need to be cognizant of, again, are the hormones. And obviously, everybody knows about testosterone. We've talked about it before. It's not a set number for anybody unless you are under 200. Then most men under the testosterone under 200 are going to have erectile issues. But there are newer treatments out there for men with low testosterone besides having to do injections. There are a couple things that we do recommend for patients. One is a new medicine called enclomiphene. It's not as new anymore. It's been out for a year or two now in more of a mass fashion. It is an estrogen antagonist, meaning it blocks the estrogen receptor, which helps to work in a couple different ways, including increasing LH, luteinizing hormone, which helps your body produce more testosterone. What's great about enclomiphene, which is a cousin, or what we call an enantiomer of Clomid, which is a fertility medicine, it lasts a shorter half-life, means it lasts shorter time in the body, less side effects, including bloating, some other sexual side effects, and we like it much better. Enclomiphene comes in usually about 3 or 4 different doses. It's usually going to come from a compounding pharmacy, and we've seen some really good success in elevating testosterone, and as such, has shown the ability to increase erections and libido and sexual function and sexual desires. That's something you definitely want to start with. One factor I've brought up in previous testosterone videos and erectile dysfunction issues videos is make sure you know what your zinc levels are, your blood zinc, and make sure you've looked at prolactin. If your prolactin is high, then you may have an issue with inhibiting testosterone production and function, and that may lead to erectile issues. So definitely be aware of that. That is as much as I am going to go into testosterone specifically in this video, but it's something you definitely need to be aware of. Then we get into the penis and the testicular issues that may be affected in terms of erectile dysfunction, how we can work to improve it. There are hundreds of online treatments out there. Some work, some don't. We're going to go into a couple things that definitely do work. The first combination that works to some degree, I've got a lot of questions on, are using things like arginine and citrulline and even like nitric oxide supplements. If the treatment is, if the erectile dysfunction is mild, those types of treatment supplements may help. A lot of times they're a nice add-on to other medications. If you do have low nitric oxide, and that's something that you can check by just doing a simple strip on your tongue, then that's something that can be very helpful for you. If you're using things like mouthwash, like a Crest or one of the main brands colored mouthwashes, that inhibits your body's ability to make nitric oxide, and that is something that if you remove that, you may be able to have normal erections. So it's something that, again, is usually helpful. Usually patients will know that they're low in nitric oxide. They'll have fatigue or brain fog or other issues that may lead to erectile dysfunction. So that's one of the basic ones. Other supplements that may help but are not as strong: yohimbine, goatweed. They work to some degree. They are not that strong. The studies are not that encouraging, but there's things that you could definitely try. Other things that may help that have a little bit more evidence behind them is something called L-carnitine. Carnitine does work a little better, increases testosterone, also increases your androgen receptors, which may help with testosterone levels and erectile dysfunction. It's something we do recommend more in terms of doing an injection. The supplement itself may increase what's called TMAO, which may lead to cholesterol and other issues. There's studies still going on about that. Other supplements that have a little more data behind them are what's called Shilajit. It's a supplement that taken in certain doses. If you take the pure derivative of it, that usually has a much more beneficial effect. Beyond that, a lot of other supplements, things like Tribulus or Maca, which work on testosterone levels, or some of them have ashwagandha in there. They may be helpful, may not be helpful. It's something, again, if this is a testosterone issue, which you'll know through your lab work, they can be helpful. They may have some arginine or citrulline in there. Citrulline is usually better. It absorbs better. It's used by the body better. It's something that definitely is a nice place to start. Much less expensive. Somewhere to go with it. If the supplements aren't working, then we move up to the next level. And then there are several options. And then there's the combo options. Everybody, at this point, most people are aware of Viagra, Cialis, the PDE5s. They will increase nitric oxide, they dilate the blood vessels in the penis and improve erection. That is, at this point, just they're generic, very simple, may improve symptoms very quickly, very easily. The side effects can be headache. There's a very slight chance you get low blood pressure, feel a little bit dizzy with it, but very rarely it's something you can discuss with your doctor. These medicines like Viagra and Cialis, we know also may have some other anti-aging benefits, including lowering the blood pressure, benefits in protecting the heart, also may help with brain health as well. And there's some smaller studies that show that. So something to definitely consider, has a lot of benefits to it, very little side effects, low cost. Then we get into some other products that are out there. Other products that you can use in terms of erectile dysfunction are, doing a video, we're going to mention peptides at some point. The one that the most common is what's called PT141. PT141 could be given either via nasal spray. There are some sucking candies, which are probably the least effective, at least from my perspective, and there's an injection in the abdomen. We don't know exactly how they work. We think they work in the brain and increase libido, and we've seen pretty good success with them. You can either do the PT141 by itself. There are PT141s that you can take with Cialis or Viagra in a combination. That is either through nose spray or sucking candy, or you can actually even mix in oxytocin. Some people will take oxytocin by itself. People know the oxytocin as a love drug. Oxytocin by itself, not usually the best unless it's more of a decreased libido issue. But oxytocin mixed with either PT141 or mixed with the triple combo of PT141 with a Viagra and the oxytocin, anywhere from 50 to 100 units in men. Women are usually more sensitive. The dose will sometimes be lower. Really good combination. Again, these are usually done either through nose spray or via sucking candy. And you do like the triple combo, those sucking candies tend to be more effective. Again, there's mixing and matching of dosing of all those different things. But we talked about the supplements, we talked about the prescriptions, we talked about the peptides that are out there. There's some other technology that's out there. There is shockwave therapy, which by itself is very successful. It's about sometimes up to 30% increase in erections, but that can also be combined with other things. Red light therapy has been shown to help very mildly, probably on the lower end of improvement, but it's there. It's not invasive at all. And then we talk about the injections that could be done right into the penis to help with erection. And they could be done by themselves. They could be done with shockwave therapy, which is the tradition. They could be done with shockwave therapy and Viagra. You can usually start with doing what's called the P-shot, which is an injection at the top of the penis with what's called PRP, which are blood cells that is blood drawn directly from your body. Certain cells are removed, injected into the penis, and that usually will hopefully provide several months of erection, if not longer. If the PRP doesn't work, then we are now using exosomes or stem cells, which are much more effective, using exosomes. These are a vesicle, or just think of a little carrier between cells that help the cells communicate, and this has been shown to have really good efficacy in treating erectile dysfunction. These procedures are much more expensive. They can run anywhere from $1,500 to $10,000. So this is not what you would run to short term or you want to do as your first choice unless you really want to spend that much money initially. A lot of times the other medicines, the Viagras or the supplements or the PT141, all can work for you, but you want to see how that works before you're doing these injections on a regular basis. Other things that sometimes can help are penis pumps. Penis pumps are actually very effective, not high cost. They do work. Sometimes they work by themselves. Sometimes they're going to work in conjunction with other things that we recommended. Again, everything also comes down to lifestyle. Make sure that you're amplifying your testosterone as much as you can, getting sleep as much as you can, dealing with the stress management. All those things will play a part in erectile dysfunction, decreased libido. If any questions, feel free to put them in the comments section. Please, if you like the content, subscribe to this channel as there's really great health and wellness content coming up.